I'm holding something that is going to revolutionize the healthcare system. It's tiny. How tiny is it? Hang on, there we go. There we go. It's tiny. It's really tiny. In fact, it's actually microscopic. So I bet you're probably wondering how. How can something the size of a freckle with features that are literally microscopic change not just our healthcare system, but every healthcare system around the world? Can I get a quick show of hands? Who amongst you has ever had a skin cancer biopsy? Okay, there's a fair few of you. All right. So what do you remember about that experience? Was it painful? Were you left with a scar? Did the results indicate that the biopsy found a problem, or was there no problem at all? Did you delay getting it checked out? How long did you put it off for? And were you scared? My name is Stefan Maisie. I'm the CEO and founder of Derma Health, and we're on a mission to prevent 1 billion avoidable skin biopsies. Skin cancer stands as the leading global cancer, costing every healthcare system billions of dollars to manage. And one of the main contributing factors is that the only way to diagnose skin cancer is via biopsy. Now, the thing is, our research has found that over 40% of skin cancer biopsies are actually benign. Now, that was more than 600,000 avoidable skin biopsies that were performed in Australia just last year, costing our healthcare system over $400 million alone. And as for melanoma, it takes on average 11 biopsies before a single melanoma is detected. So why am I talking about skin cancer? Well, in 2020, my mum found a small dry patch of skin on the side of her nose. It looked a little bit strange, but it went away. It then came back again, a little bit bigger, and then it went away again. And this repeated for about 12 months. And to her, look, it didn't look serious. And just like 22% of the adult population, she also suffered some form of needle phobia. So she knew that if she went to the doctor, she would likely be having some sort of biopsy for testing. So these phobias and these chain of events led to her seeking an early diagnosis. Now, thankfully, she did go see the doctor, and unfortunately, it did require a biopsy. And it turned out to be in a very aggressive BCC that required Mohs surgery for removal. So the procedure requires a surgeon to carefully cut around the lesion, trying to preserve as much healthy skin as possible. They'll then send the sample off, and you have to wait at the surgery for a few hours until the results come back. And if the results come back as positive, the surgeon will go back in, remove a larger diameter of tissue, and they'll keep repeating this until the results come back as negative. This procedure resulted in the surgical removal of cartilage from my mum's nose due to the damage caused by the underlying cancer. It then led to the ongoing lifelong sleep apnea that affects her today. So I know firsthand that fear that creates a delay in seeking early diagnosis is really significant. And her experience serves as a painful reminder of the human cost associated with delaying something as simple as a lesion. So knowing that there is no other way to diagnose skin cancer other than a biopsy, I want to do something about it. And standing here today, I'm proud to say that we have developed a world-first Australian technology, a new way to screen for skin cancer. The DermaPatch represents groundbreaking advancements in skin and digital diagnostics and Industry 4.0 manufacturing. It's a first-of-its-kind microneedle device comprised of uniquely barbed structures that can quickly and effectively extract skin cells pain-free, requiring significantly less tissue than a biopsy, and is more cost-effective. So normally, if a doctor cannot rule out skin cancer, a biopsy or excision is performed for confirmation. With the DermaPatch, it can be applied onto the lesion and collects a microtissue sample that can then be sent to any lab for analysis. Our proprietary RNA gene assay that measures gene expression can detect cancerous changes from just a few cells, screening against a spectrum of skin cancers, including melanoma. And the outcome serves as a pre-screening solution to determine if a biopsy or excision is actually necessary. So in most countries, only doctors can do biopsies due to their invasiveness. Our solution, however, enables nurses and allied health to be able to administer a biopsy-equivalent diagnostic test for the very first time. and perhaps in the future at home by a patient themselves, just like the at-home bowel cancer screening test. So why me? Why am I the right person to bring this technology that merges microfabrication, material sciences, genetics, and dermatology to market? I'm definitely an outlier. It's definitely a big part of my identity, and I think it's something that really took me into my 30s to fully embrace. But if you sort of zoom out and you look at my life in a straight line, it becomes really clear that grasping all of these expertise plus more has been woven into like my very journey. So for example, at 19, I taught myself genetics, and at 21, I developed Skin DNA, a consumer DNA test that can tell you how your skin will age. I then opened up a genomics facility, followed by an award-winning cosmetic clinic. So while my mother's experience may have been the catalyst, what are the odds that an experience like that would happen to someone with my unique set of life experiences? And it's this sort of passion that has gone on to attract other passionate people from diverse industries needed to help us reach our milestones. Now, in terms of milestones, our next milestones revolve around clinical data. As a medtech startup, trying to get clinical trial funding is pretty much the valley of death. So we had to think differently, we had to be outliers, we had to think outside the box. How are we going to do this? And we found a way. We came across the Western Australian government's new Pilbara Challenge. We were selected and were given 12 months to fast-track a proof of concept. It also gave us access to healthcare providers of all sizes across the Pilbara region, from Port Hedland all the way to Karratha. Now, for context, we are a Sydney-based startup, and some of these places are about 2 flights and 13 hours to get to. So we do know remote very, very well. But some of the experiences that we learned, for example, we got to learn about the skin cancer screening practices at Rio Tinto that led to the introduction to the chief medical officer responsible for 57,000 employees. We also had the opportunity to go on-country to smaller Indigenous communities of 200 people, gaining insights into the challenges and limitations of remote healthcare delivery. Now, community is a big one here because skin cancer affects everyone. And seeing the impact and learning about the practices and the current limitations in our own backyard was truly an experience that I will never forget. Now, in the end, we got our early clinical trial data, we validated our solution, and we sparked a chain reaction, garnering regional and then national interest, and now international interest, being a finalist as a Science Startup of the Year at the Falling Walls Foundation, proving that even the smallest company with a powerful idea can make a global impact. So earlier I mentioned that over 600,000 avoidable skin biopsies were performed in Australia just last year. So hold on to that for a moment. So we often hear about the need for more doctors or the need to invest billions of dollars in new infrastructure just to reduce wait times. But can you imagine what our healthcare system would look like if 600,000 GP appointments went to patients who really needed them by making a single adjustment, by utilizing the nurse and allied health workforce to triage patients with suspected skin cancer? What would that look like? What could that look like? And how many lives do you think that would save? This is how I believe something the size of a freckle, with features that are literally invisible to your eye, can make a meaningful difference to the lives of 1 billion people, one pain-free patch at a time. Thank you.